Bismillahirrahmanirrahim. Thank you, Ms. Moderator. Respected Chairperson, learned audience, Assalamu alaikum and good morning to you all. I myself, Dr. S.M. Rokonuzzaman, working in Cancer Center, CMS Dhaka. I am radiation oncologist. My topic is quality of life of radical prostatectomy versus radical radiotherapy in patients with localized or locally advanced prostate cancer. According to Globocan 2022, around 1.4 million new prostate cancer cases diagnosed globally. Prostate cancer is the first highest incidence of all cancers and fifth highest mortality rate globally. Highest incidence in Northern Europe and highest mortality rate in Southern Africa. As you know, have seen the screen, this is the incidence and this is the mortality Globocan, according to Globocan. As you know, prostate cancer is a common male malignancy when detected early as localized or locally advanced disease. It is highly curable with excellent long-term survival outcomes. The main curative treatments for localized prostate cancers are radical prostatectomy involving complete surgical removal of the prostate gland and radical radiotherapy which eradicates cancer cells through targeted radiation while preserving the gland. Both treatments work equally well, but they affect quality of life differently. So patients need careful guidance to choose the best options. So the options are radical prostatectomy, which involves open laparoscopic or robot-assisted prostatectomy, or radical radiotherapy that involves external beam radiotherapy, sometimes combined with brachytherapy. As you know, radical prostatectomy is the gold standard treatment for prostate cancer, because it provides accurate pathological staging, offers excellent long-term survival outcomes in younger, healthier men, strong evidence from randomized trials and long-term cohorts. It is also comparable survival advantages of our radical radiotherapy that it better 10 years overall survival compared to radical radiotherapy, that is 77% versus 67%, fewer risk of metastasis and recurrences, better prostate cancer specific survival compared to radical radiotherapy, that is 92% versus 88%. But radical prostatectomy significantly affects quality of life. According to different journals, it's higher incidence of urinary incontinence, significant deterioration in sexual function, and also effects in bowel function. In comparison, radical radiotherapy has significantly improves different complaints like milder effect on urinary incontinence, more bowel toxicity, which improves within 2 years, gradual reduction in sexual function over times. According to NCCN guideline, you can see in low risk group and in high risk group, that is radical radiotherapy is the category 1 upfront treatment nowadays. But in unfavorable intermediate risk group, radical radiotherapy is upfront. According to European Association of Urology and American Urology Association and ASTRO 2022 guideline, radical radiotherapy is superior in terms of quality of life, but radical prostatectomy is superior in terms of longer survival, that means overall survival. In this context, we have designed our study. Our study population was 73, and duration starts from January 2018 to January 2024, and place of study was Cancer Center, CMS Dhaka. We have randomized radical prostatectomy versus radical radiotherapy, and the parameters are urinary function, bowel function, sexual function, and general health and well-being. We have 2 arms, radical prostatectomy, which is complete resection of the tumor, and the second arm is radical radiotherapy, and we have planned 2 to 2.5 gray per fraction over 70 to 80 gray over a period of 6 to 7 weeks. Intensity modulated radiotherapy or volumetric modulated arc therapy has been applied. These are the inclusions and exclusion criteria of our study. In inclusion, adult patient ranging from 45 to 85 years, patients with the histological confirmed adenocarcinoma, localized or locally advanced prostate cancer, patients who undergone radical prostatectomy and radical radiotherapy. In exclusion, patients with distant metastasis, prior pelvic malignancy treated with pelvic radiotherapy or surgery, patients with severe comorbidity and poor performance status. Quality of life questionnaires used in our study is EPIC 26, International Index of Erectile Function, that is IIEF, URTC QLQ C30, and these sample questionnaires are flashed on the screen. This is EPIC 26 scoring manual. And this is how we have treated patient by intensity modulated radiotherapy or volumetric modulated art therapy. This is contouring and planning models. And this is the DI-based dose volume histogram of our study. This is how we have treated by volumetric modulated radiation therapy. In results, we have seen that in early stage, radical prostatectomy has much significantly effects in urinary incontinence, that is 75% versus 34% in radical radiotherapy. And also in sexual function, we have seen that 60% of patients having sexual function in comparison to radical radiotherapy is only 25%. But radical radiotherapy has significant effect on bowel toxicity, that is 45% versus 4%. In EPIC 26 score trends, you have seen that the radical prostatectomy has hugely impact on early stage of the disease, but in the later stage it is nearly equal to the radical radiotherapy. And also in bowel function, you can see that radical radiotherapy has more bowel effect in comparison to radical radiotherapy. And IIEF QL score has seen that radical prostatectomy has hugely affect erectile function. In comparison, radical radiotherapy is very low function, low effects in radical radiotherapy. And quality of life, you can see that is two arms having equal or similar quality of life in both radiotherapy and both surgery. In summary of our study, you have seen urinary function is, in urinary function, radical prostatectomy has more severe impact, and also, but also radical radiotherapy has more effect on bowel function, and radical radiotherapy is superior in preserving sexual function. We have compared with our study to other international publications like European Association of Urology, American Urology Association, ESTRO, and other studies. We have seen that the study is more or equal to other studies. In conclusion, radical prostatectomy is better survival outcomes than radical radiotherapy, whereas radical radiotherapy has superior quality of life than radical prostatectomy. So the selection of treatment should be guided by individual patient's priority, baseline functional status, disease statistics, and the relative importance of urinary, bowel, and sexual function to each patient's overall quality of life. These are the references of our study. This is our beautiful cancer center, CMS Dhaka. And this is TrueBeam linear accelerator machine. We have used intensity modulated radiotherapy with this machine. And thank you all. Wish you a healthy prostate.
Thank you so much, Colonel Dr. S.M. Rokonuzzaman sir, for your excellent presentation. Our next presentation from Dr.